So we're going to take a look here at the musculoskeletal system, looking predominantly at the bones. We're not going to look too much in terms of identification of various bones. What we're going to do here is look at the structure and function of bone and bone tissue, as opposed to identification of various bones, which we'll be dealing with in lab. So we'll start by looking at the general characteristics of the tissues that we're going to be dealing with. And we'll start by looking at histologically the cells and tissues that are going to make up the bones, and then how those bone structures come about. So we're predominantly looking at connective tissue, in which we're looking at cartilage and the chondrocytes within the cartilage, dense connective tissue, in particular dense regular connective tissue. There are other connective tissues that are going to be involved. There's also epithelial tissue that we'll see. But the predominant tissue and the predominant cell that we're going to see are the osteocytes. When we're talking about the osteocytes and the chondrocytes, we have to differentiate as to what they are doing. If they are building up the tissue, we reference them as being blast, and so you'll hear discussion of osteoblasts. If they are recycling tissue, or what people refer to as destroying tissue, then we look at the clasts, such as the osteoclasts. The osteocyte itself can become both blastic as well as clastic. When it's not doing anything, it will simply be the osteocyte. So if we continue looking at the microstructure from those types of cells that we'll see, the osteocytes, whether they are osteoblasts or osteoclasts, we will get distinct histological or tissue structures. Regardless of where we see the bone will always form concentric circular rings, which we refer to as the osteons. There are two types of osteons. There is cortical osteon to the lateral surface of the bone, and there is trabecular osteon to the medullar side or the medial side of the bone. Within the osteons, we will see things like canicules, Hervatian or central canals, and Volkmann's or perforating canals. The predominant part of the tissue will be the lamina, and contained within the lamina are small little structures that will house the osteocytes, the lacunae. And so let's take a look at what this looks like. So the developing bone is going to look something like what we see here in terms of the slide, where we're going to have the osteoid, that is the ossifying mass of bone tissue coming about, being produced by the osteoblasts. We have the dormant cell within the lacunae, the osteocyte. And then we have the cell that is going about the digestion of the bone matrix, the osteoclast. There is secondary video presentations that you might be able to view if you so choose to get some more information that go into how this differentiates itself in terms of bone turnover. In terms of how this sets up within the bone itself, this is what we're looking at in terms of the bone itself, where we have the osteon with its concentrically ringed lamina in the cortical areas, and then the osteons in its spindle form within the trabecular area of the bone. If we further break this up, we can actually look at the different regions that we see within the bone, where we have our trabecular spindles or trabecular spines, and then our concentric laminas in the cortical region. In the center part of the region, we will have the medullary cavity, which we'll see here in a second, with the perforating or nutrient arteries and veins, as well as the nerve. These are going to pass through the trabecular into the Volkmann's or the perforating canals that the concentrically ringed laminas will surround, but allow for passage of the blood vessels into the areas, into the Hervatian or central canal, which is going to be central to the osteon laminal rings. Stemming from the Hervatian or central canal are openings of the lamina, which are known as the caniculus or the canicules in plural, that are going to be connecting the dormant osteocytes housed within the lacunae. What's happening is that blood will circulate from these perforating and Herbacean blood vessels. They will stem through the canicules into the osteons, and then come back through the canicules to the veins, and then exit the bone itself. Surrounding the bone itself, we have different layers of connective tissue. There's two predominant layers, the endosteum and the paraosteum. The endosteum is going to be to the trabecular region of the bone itself. The paraosteum is to the most lateral side of the bone itself. It's this paraosteum that's going to develop into the ligaments and capsules of the articulations that we'll take a look at. Whether we're looking at endosteum or paraosteum, it is dense regular connective tissue with seral epithelial tissue surrounding it. What ends up happening is that we have different layers that take place within it. We have what's referred to as the fibrous layer and then the cellular layer. The fibrous layer is predominantly just dense regular connective tissue, the protein fibers themselves. The cellular layer are going to be the fibroblasts as well as some of the epithelial tissues producing the seral epithelium. What the cellular layer is doing is it's projecting predominantly collagen fibers into what's referred to as a perforating fiber. This perforating fiber is going to connect with the canicules. And what the perforating fibers are able to do is they're able to traverse through the laminals into the medullary cavity of the bone in junction with the endosteum on the internal surface of the bone. What the paraosteum and endosteum is doing is it's encapsulating the bone so that the bone structure itself will constantly stay intact. These bone tissues, these canicules connecting the laminals surrounding the Herbacean systems within the osteons and the trabecular spindles will form into the macrostructure of the bone. The macrostructure of the bone gets broken down based off of how the bone is shaped and how the bone grows. This includes things like long, short, irregular, and flat bones, as well as the sesamoid bones, but it also includes the microstructural parts of the bone that we just looked at, the trabecular as well as the cortical. Now, a lot of books like to talk about this microstructure as being spongy and compact. The problem is that there is no spongy and there is no compact bone. Bone is always compact. It's very hard. The difference between the trabecular and the cortical is the arrangement of the osteons, where in the cortical region, the osteons are running parallel to each other in the lateral aspect of the bone, whereas in the trabecular, the osteons are angled towards each other at tangents without having any parallelity within the osteons. That is, the osteons are not running parallel to each other or in line with each other within the bone itself. So if we take a look at the skeleton itself, we can look at where we might see some of these various types of bones in terms of flat, long, short, or irregular bones. The principal sesamoid bones that we have are going to be the patella, as well as some of the sesamoid bones that we see within the foot. In total, we have somewhere around 208 to 220 something bones. The total number of bones is dependent upon how we want to count some of the lambdoid bones that we have within the skull, or some of the sesamoid bones that we have within the lower extremities. When we start looking at the bone itself, particularly within the long and the short bones, we get distinct areas that we will see within the bone, which we refer to as the macrostructure. This includes the epiphysis, the diaphysis, the articulating cartilaginous edges, as well as the medullary cavity with the bone marrows that are found within it. And so let's take a look at what we're seeing within these areas. And so we have the epiphyseal area, which is the ends of the bone. If it's to the proximal side, it would be the proximal epiphyseus. If it's to the distal side, it's the distal epiphyseus. The central part of the bone, the majority of the bone, is the diaphyseus. Sometimes we'll reference this as the body of the bone when we do the identification. The bone itself is made up of the two types of bone tissue, the trabecular bone and the cortical bone. Notice the difference that we see in terms of the arrangement of the two bones and where we will see them. In the center of the diaphyseus is a hollow canal known as the medullary cavity. I'll explain why that medullary cavity comes into play when we look at the physiology of the bone here in a second. In the medullary cavity, we're going to have a depositing of adipose tissue, what's referred to as yellow bone marrow. The yellow bone marrow is there to provide protection to the nutrient artery and vein passing through the bone, as well as the nerve to the bone that passes within the medullary cavity. On the edges of the epiphyseus, we get the articulating cartilage regions, or the articulating edges of the bone. Within the epiphyseus, we get what's referred to as the epiphyseal region, or the epiphyseal plate, or the epiphyseal line. This is the area where bone will grow in an apical or elongating fashion. And we'll talk about how that comes about when we look at the physiology of the bone as well. The other principal arrangement that we'll see is in the flat irregular bone. Now notice there's a big difference here. We do not have the medullary cavity in the flat bone that we have within the long bone. What we have is we have a sandwiching of trabecular bone in between the cortical bones. The way in which the bone gets developed is going to dictate whether it's going to have the flat bone macrostructural arrangement or the long bone macrostructural arrangement.